Hello, it's Dr. Pat with Little Critters Veterinary Hospital, and we have a beautiful little bird here today. This is Pigeon, aptly named, and she was just found on the side of the street. And the important thing to realize is Pigeon is just a baby. When we look at Pigeon and examine Pigeon, we have brand new feathers coming in everywhere and pin feathers throughout. And we also have a wing lesion. So you can see that she's missing many of her secondary flight feathers, and the wing is hanging or falling here. And we've lost most of our tail feathers back here. We're also very dehydrated, very thin or emaciated. When we palpate the keel here, it's like a razor blade. There's just no fat, no muscling there. We're going to try to gently lift the other wing, and you can see some of the pin feathers coming in all under here. These are all brand new baby feathers. Young pigeons are called squabs, and so she's probably just at the end or just getting past the squab stage. Usually they consider squabs between 2 and 4 weeks old. I would guesstimate her age somewhere between 5 and 6 weeks old, because she's got most of her feathers, but they're still kind of emerging pretty much all over her body, but she doesn't have any of the fuzzy kind of down feathers that we'll see often on the head that's persistent in babies. Her beak is still really soft in texture. The physical exam revealed large swelling over her elbow. So this whole area is very swollen. There's no open wounds, but it's significantly enlarged compared to the other wing. She doesn't have any skin wounds anywhere on her body, which is good. Oftentimes these babies are caught by dogs or cats, and we'll see pretty significant severe injuries. Very potentially a predator got her tail feathers, and she was able to get away from that. We also see fledgling injuries, where their first flight out of the nest is very uncontrolled and will often have fractures and injuries just because they don't have power steering yet. It's very common in baby birds. She is pretty dehydrated and, like I said, emaciated, and she has some diarrhea stuck to her cloaca or her vent. We will do a fecal today. We're doing some blood work to see what's going on inside. We did check her mouth. There are no obvious trichomoniasis lesions, which is very good. We're going to start tube feeding her into her crop. She's old enough that she could eat on her own, but she's very weak, so until she starts eating, we're going to tube feed her, which will provide fluids and nutrition. And we are going to give her some subcutaneous fluids today, as well as warming, just because she's lost so much body mass. She's not maintaining her temperature very well. And we are getting radiographs of this x-ray, and we'll update you on what that looks like. Some wonderful people that found this little baby on the road and elected to stop and do something about it. I commend them. They're exceptional people, and she was worth trying for. And I should add on that I said she, but my suspicion is we're going to be a he. It's hard to tell. If you look at the back of the neck here, we're starting to get a whole bunch of iridescent feathers. So I suspect we're going to be a boy.